Good evening. This is Congresswoman Mary Gay Scanlon. Thank you for joining our live, interactive telephone town hall. We're hosting this event so my team and I can hear directly from you, wherever you are, and answer as many questions as possible. This evening, we'll be discussing the coronavirus outbreak, otherwise known as COVID-19. I'm going to be joined by my colleague, Congresswoman Donna Shalala, Dr. Valar Kush, Chair of the Montgomery County Commissioners, Timothy Boyce, the Director of Emergency Services of Delaware County, Mark Ross, the Vice President of Emergency Services for the Hospital and Health System of Pennsylvania, and Dan Taylor, an Associate Professor at Drexel College of Medicine and a pediatrician at St. Christopher's Hospital. As I mentioned, this will be an interactive forum, and we want to hear from you. We'll be taking as many questions as we possibly can live on the event. If you have a question, you can press *3 on your phone keypad at any time, and you'll be placed in line to speak with a member of our staff. They'll take down your name and where you're calling from. The next time you hear your name, you'll be live on the call, and you'll be able to ask your question directly. We'll do our best to answer as many questions as we possibly can this evening. We anticipate a lot of questions, so if we're not able to get to yours, you can leave a voicemail after the event, or you can call our district office at 610-626-2020 tomorrow, or you can go to scanlon.house.gov to submit a written question or comment. Again, if you have any questions throughout the event, please press *3 on your keypad or type them below the streaming player. We're going to wait for a few more people to join, and we'll get started in just a couple minutes. Time to get started. Good evening, everyone. This is Mary Gay Scanlon, your congressional representative in Pennsylvania's 5th Congressional District. Thank you for joining us for this important telephone town hall to discuss the coronavirus, or COVID-19. I know that for many of you, for all of us, the past few days have been challenging, and I understand the uncertainty and anxiety that many of us are feeling. We wanted to organize this call so that we can do our best to answer your questions, to provide updates on what's happening, to address the coronavirus outbreak on the federal, state, and local level, and answer any questions you might have. I'm so pleased to have several experts on the line with us, and I want to introduce them to you. We have Congresswoman Donna Shalala, who, like me, is a freshman congressman. She represents Florida's 27th district, but she also served as the United States Secretary of Health and Human Services under the Clinton administration. We have Dr. Valar Kush, the chair of the Montgomery County Commissioners, who happens also to be a public health doctor and who's been leading response efforts in Montgomery County. We have Timothy Boyce, the Director of Emergency Services for Delaware County, who's been leading emergency response efforts in this county. And we have Mark Ross, Vice President of Emergency Management for the Hospital and Health System Association of Pennsylvania, who's been helping organize and coordinate statewide efforts to respond to COVID-19. And finally, we have Dr. Taylor, who is an Associate Professor at Drexel College of Medicine and is also a pediatrician at St. Christopher's Hospital. So, Congresswoman Shalala, can you give a brief update on legislation that the House and Senate are working on to address the immediate needs of families in response to COVID-19?
Yes, thank you, Mary Gay. Let me briefly explain what Congress has done. Very rarely does Congress move as quickly as it has. The first bill we passed is an $8.3 billion bill to fund research and vaccine development. The truth is that for this pandemic, we have no treatment, and we don't expect to have a vaccine for at least a couple of years. So the emphasis on treatment is extremely important. The second bill we did was focused on families and on workers. We wanted to make sure that no one had to pay for their test, whether they were insured or uninsured. We also got a bill through that included emergency paid sick leave and family leave, as well as a deep investment in unemployment insurance for those who are furloughed or actually lose their jobs. And we're very concerned, particularly about small and medium-sized businesses who have been hit dramatically by really our public health efforts to keep everybody at home. And finally, we've done a number of things on nutrition assistance, including making sure kids that get free meals at school will be getting their meals, and an investment in senior nutrition, as well as expanding the SNAP benefits, the old food stamp program. Our third bill, and those first two have passed both houses. Our third bill will be economic incentives to actually, there'll be stimulus investments that will help us to stimulate the economy, because with everybody out of work or at home, we're really headed for a very serious recession, and we're working on that bill now. Let me end there, and I'd be happy to answer any questions about the programs.
Okay, thank you. Dr. Akush, can you give us a brief update on response efforts in Montco?
Sure, and thank you, Congresswoman, so much for having me join you tonight. So we have been here in Montgomery County at the center of the outbreak in the state of Pennsylvania. We got notice of our first 2 cases in Montgomery County just a week ago Saturday, and now 12 days later, we have 42 cases as of midday today, 42 individuals that have tested positive. And as of this morning, 512 people in quarantine. So that can just give you a little bit of the sense of how rapidly this and how contagious this virus is. So we have spent the last 12 days really ramping up our emergency response, working very hard to educate the public on the challenge that is with us. We have closed our schools. We're doing our level best to get many businesses to close, those that are not essential. We have prohibited people from dining in restaurants. They could still do takeout and delivery, but we don't want people congregating in restaurants. And we've done a lot of work, and there'll be much more needed, similar to what Congresswoman Shalala pointed out, to help everybody get through this crisis. So our Commerce Department is working with our small business community in particular and working to put together some rapid response funds for them. We have spent a lot of effort on our safety net in the county. We have 830,000 people in the county. So we have moved very quickly to get all of our utility companies on board to not have any terminations of any utilities during this emergency. Our president judge of our court has given out a directive that no one can be evicted from their home during this emergency, and we have gotten the agreement of our sheriff to not enforce any existing eviction orders. We're fortunate to have a very active food safety network in the county, the Montco Anti-Hunger Network. They're working very closely with our 22 school districts to identify kids that might need help getting through this, as many of our children get their most nutritious meal of the day at school. And they're supporting a lot of local school efforts to make sure that kids are getting enough food. And then we're also working with our seniors, particularly on our Meals on Wheels program. The county delivers somewhere on the order of 250,000 meals a year to seniors. So we've lost some volunteers and things like that on this program, so we're just making sure that we're filling in all those holes. And many, many other things that we're doing. Probably the most important of which is we're about to set up a testing site, a drive-through testing site that would make testing a little more broadly available in Montgomery County. I think access to testing has been something that's been very frustrating for everyone. And I'll stop there, and we'll be happy to answer questions.
Okay, yes, you mentioned the moratorium on evictions. I think we've seen that in all the counties that are in the 5th Congressional District, Philadelphia County, Delaware County, and Montgomery County. So there is a moratorium in all the courts on evictions, and we're certainly seeing a lot of information about where school meals can be picked up. Next, we have Timothy Boyce, the Director of Emergency Services for Delaware County. Can you give us an update on response efforts in Delaware County?
Yeah, good evening, Congresswoman. Dr. Taylor is in council as we speak and will hopefully join us by the end of the call. Where we are from public safety is the preparedness front and gearing up for response across the county and with our neighboring counties. And I thank the Dr. Montgomery County, Chester County, great partners. But all of our departments, our public safety people are preparing. We're seeing actually call volume down at our 911 centers as people heed the warnings to stay inside and be responsible. But we're really focused on just a couple of key functions here. One, that we're supporting public safety, that our first responders have the protection they need, and including our hospital workers, but our first responders have the materials they need. Across the region, you are seeing police departments and fire departments alter how they do normal business. The level of service remains extremely high, but they're just being prudent on calling back more people and trying to reduce the social contact. From a government level, both here at our county and supporting our municipalities, our governments are functioning. I know a lot of our buildings are closed, but we are making sure that essential services that government provides are there and that we can sustain that going forward. Some of the other parts we're working on is really recruiting more volunteers to serve. All of our counties have volunteer organizations, be it a Citizens Corps or Medical Reserve Corps. These are citizens that donate their time and their talents to help others in need. We're very fortunate in Delaware County to have a tremendous resource in our volunteers, and we're counting on more people to join in and help one another. Obviously, we have an issue with our prison where there is some health care issues there, and that's being addressed both on making sure that all of our institutions are safe and people are well cared for, and that we're treating people responsibly. Looping back to our 911 system, we do ask that people call ahead. If you believe you're sick or you believe you have the symptoms, we're asking you to call and inform us. We're also asking you to call your primary care doctor first or a walk-in clinic. Let them know that your symptoms are over the phone. Maybe they can manage it that way with the goal of reducing the surge that we're seeing in our ERs. Again, you don't want to go to the ER and pick up something. And a new policy that's going to be coming out, you may be asked if you call 911 for a medical call, could you come outside and meet our first responders? All these elements are really making sure that our first responders and our community remains robust and there to serve you. Dr. Taylor, I'm hoping leaves council in a few minutes with some positive news about the health department. So, Congresswoman, if I can defer that, I will for the time being.
That sounds great. Mr. Boyce, could you provide a brief update on, Mr. Russ, can you share any updates on the state's efforts to respond?
Absolutely. Thank you, Congresswoman. I'm speaking from the healthcare perspective. The Hospital and Health System Association facilitates and coordinates the 7 healthcare coalitions across the state. These coalitions work to plan, train, and exercise together and have been doing so for a number of years. With this response, the hospitals and health systems of the state have been coordinating their response efforts, coordinating with local agencies, and coordinating through the Pennsylvania Department of Health and the State Emergency Operations Center for planning for surge, for any potential surge into our facility, planning for any unmet needs that may be seen by our facilities, whether that be staff, equipment, supplies, and working to make sure that we are still providing that daily level of excellent health care that your constituents are used to on a daily basis before COVID-19. With that, our facilities continue to work unified to address these issues, and we are prepared to meet the challenges as they come to us and be able to provide the care that we do to your constituents and others across the state. We are meeting daily with the hospitals and health systems of the state. We are coordinating calls with the State Department of Health and with local agencies to assure that we are ready to respond. With that, Congressman, I will hold for any questions.
Okay, thank you. And you've been very helpful as we've had a variety of meetings with healthcare providers across the district and across the region. Next, I'm going to ask Dr. Dan Taylor to talk about what he's seeing and with respect to the impact on kids And just so people are aware, we're going to have two Dr. Taylors on this call. Dr. Monica Taylor is a commissioner with the Delaware County Council, and Dr. Dan Taylor is an associate professor at Drexel College of Medicine and a pediatrician at St. Chris's. Dr. Taylor, the pediatrician.
Thank you so much for clarifying which Taylor I am and for inviting me on this call with such prestigious guests and guests who are really on the front lines and really understand the major issues that this pandemic now is doing to both the economy and to individual families and, for me, children as well. I'm a pediatrician at St. Christopher's Hospital in one of the areas of Philadelphia that is the epicenter of poverty and stress, but also resilience. And I can answer questions. I can discuss some of the impacts on children and families. But right now, as many of the callers probably understand, it's not affecting children as too much. They are probably protected right now from the virus for many different reasons. But there is a term that we're all learning about. It's called K-0. And what that is if one person is infected with it, whether they're symptomatic or not, they can give it to what we think is 2 to 4 other people, and then those people will continue to give it. So without the social isolation that everybody is talking about, without the social distancing, staying in your home except for essential needs, and really staying away from people that are sick, this can spread rapidly. And that's what we're seeing in Montgomery County. It's happening in Philadelphia. It's happening all over the country. One thing I'd also like to just stress is we're all in this together. We're all neighbors. We need to really care for each other, care for the elderly in our community, not be greedy, especially. We have some families who are really worried who depend on things like WIC and food stamps that really limit their ability to purchase a certain amount of formula or food for a month until it's renewed, or 3 months. And we're seeing families that are really worried because they're going to supermarkets and they're not being able to find things like formula for their children or even essentials like diapers because people with more means are able to actually purchase those in bulk. So I think we all need to just really try and think about those others, the ones who can't afford to buy 6 months, 1 year supply of diapers and formula, and to really just purchase what you need for the month, and then just know that it will be restocked. And I'd be glad to take any questions on what we're doing on the ground in a urban hospital.
Okay, thank you. We're now going to start taking questions from constituents.
So the first question is from Brooke in Newtown Square, who has a question regarding symptoms in children. Dr. Taylor, if you could, when she gets done asking this question, answer that would be helpful.
Sure.
Hi, I just had a question as far as children presenting with the same symptoms, because I did just hear a 1-year-old is hospitalized with it. I think they said Montgomery County.
I didn't hear about that yet, but things are, they're evolving so quickly.
That is correct. There is a
Okay.
1-year-old hospitalized, yeah.
Okay. And there's sometimes what are called co-infections. So it could be that they have both COVID as well as another respiratory infection as well that can be causing the symptoms. But we're learning every day about symptoms in children. Initially, sometimes it's GI symptoms like an upset stomach or vomiting, a low-grade fever, sometimes a little bit higher, a stuffy nose, not really a profuse runny nose where you're blowing the nose all the time, and a cough. Those are some of the classic symptoms we're seeing, but that can also represent almost every single other cold virus that we see on a daily basis, both in the wintertime and the springtime as well. So it is difficult to determine which children potentially could have COVID. We're still using risks, meaning if they had a close contact with somebody with a confirmed case of COVID, or if they've traveled recently to high-risk countries and now actually also traveled recently domestically. I hope that answers your question.
Thank you, Dr. Taylor. The next question is from Eileen in Bushwick. She has a question regarding the senior community.
Good evening. I live in a HUD-subsidized senior community of 240 apartments in Boothwyn. Most of our residents do not drive. If someone here is advised to go for testing, how would we get there and how would we get home?
Mr. Boyce, do you have a suggestion?
Yeah. What we're asking the public is, when in doubt, call 911. If your symptoms are something that it's urgent, we would address that. Right now, we are trying to stand up some information numbers, healthcare numbers, but when in doubt, please always call 911 and let's have a conversation. We are looking for transportation, so there are issues that I would ask you to address there, and then perhaps if there's specific questions, Congressman, we can get back on a number like that. Community transit is still in service, and the public health transportation network is still working.
The next question is from Judy, who lives in Norwood, and she would like an update on Delaware County and Chester County combining resources.
Good evening. Thank you, Congresswoman Scanlon. I guess this would be addressed to Mr. Boyce. My concern is that because Delaware County doesn't have a health department and now they are joining with Chester County for assistance, my concern is certainly there being enough staff, and also does Delaware County have any type of health structure that they could then join with Chester County? And then a second question, would testing sites be set up in Delaware County? I think I know.
Okay.
Tim, if you wouldn't mind answering my question.
Sure. I'm not intimately involved in the negotiations, but I can handle the question. Delaware County is supported by the Pennsylvania Department of Health. They have the full resources of the Commonwealth. I think what people are concerned with, and we've expressed, all members of council have been in support for a long time of bringing the healthcare Department of Health here to Delaware County. That said, we do get support from the Commonwealth. There are laws that restrict what the state can say and a county can say. Obviously, Monco and Chester are in a better position to communicate with the public, but we do have those resources. Currently, we have what's called Department of Intercommunity Health that supports that. We have a senior medical advisor. So we do have these resources. Chester and Upper Darby have health departments, and Chester County has that capacity. That's one of the things that my Dr. Taylor is speaking about tonight, that there is this capacity in Chester County. The region operates as a partnership every day. So we believe that the capacity is there to do things better and efficiently without waiting for the longer play of establishing a full health department.
Thank you, and I can just add a little bit to that. So the three counties here are working very, very closely together. I've been really impressed by how well they're coordinating services. The Department of Health for the entire state will retain overall authority for Delaware County, but Chester County is going to be able to provide services in place of there not being a Delaware County health department for the present. But this is all being worked out. There have been assurances that there's plenty of capacity. And there are more and more testing sites coming online every day. So next question.
Our next question is from Joe, who has a question regarding potential money and payments being sent out to seniors.
Oh, yes. Am I on the hello?
Hi.
Okay.
You can ask your question.
Yes. My question would be in regards to the seniors. I'm 88. My wife is 86. Now, recently she had some medical problems, and I work 3 days a week part-time at my age to pay my medical bills, etc. Now, and I don't get paid because I work for a security company. Now, is there any provision that they're having for seniors of our status, and which we would get some relief for this? Now, that's my primary question, but I do have another one. This is in regards to Congress Lady Scanlon. I am a veteran of Korean War, 1950 to 19, and I got a disability. I had filed. It's almost 2.5. It is 2.5 years, and I have not got any results of this whatsoever. Is there anyone working in the VA that can help me as a senior to get this thing? My records were in a fire in 1960, as was World War I, World War II, and that's my question.
Thank you, sir.
So we can put, if you can call our office, which is 610-626-2020, we can connect you with a constituent service representative who can help you with the VA benefits. With respect to special payments for seniors, I think thus far the legislation that's been proposed has to do with paid sick leave for working Americans. Donna, do you want to elaborate on that? I mean, Congresswoman Shalala?
Yeah, I'm not quite sure. If you get laid off from your job, if you're furloughed, if you can't work, you are eligible for unemployment insurance. And we have both given the state of Pennsylvania extra money for setting up the administrative structure for that. That certainly is available. The other thing that's available for seniors is that we will have nutrition assistance for seniors, and it depends on how Pennsylvania is going to organize that, whether they're going to deliver meals. But there's not direct cash assistance to increase your Social Security payment or your Medicare at this time. If for some terrible reason you get coronavirus, there is coverage both for the testing, and Medicare you will not have to pay for anything, and Medicare will cover your treatment.
Thank you.
The next question is from Elizabeth in Yaden, who has a question about the ER hospitals in Delco.
Yes, good evening. I was wondering if all of the hospitals in Delaware County, the ERs, had the testing kits available, and do they have the right medium to put the testing swabs into, and who is actually doing the testing?
Congressman, this is Tim Boyd. Ma'am, I can assure you that every hospital and healthcare facility has access to it. I would defer to one of the physicians as to the process.
Okay, and go ahead.
This is Mark Ross from the Hospital Association. Yes, all the hospitals do have the ability to test. That testing depends on the range of who is doing it, whether that is a commercial lab doing the testing or whether that is the state Department of Health lab in Lionville that is doing the testing.
Okay, and let's just be clear for people that the first thing they should do is go to their personal physician, their primary care physician, because that physician can determine whether or not you've got seasonal allergies or whether or not you need to get a test and write the order. There are a number of places other than emergency rooms where you can get the test, and your physician can help you do that.
This is Dr. Taylor. I'd like to just clarify when you say go to the physician, call first.
Right.
Don't go to the hospital or to the outpatient center without calling first. That's what we're trying to avoid. We're trying to avoid people getting on the bus, train, exposing other people potentially. So call first, please.
And by not going to the hospital unless you need that acute level of care, you're preserving the capacity of the hospitals to provide that acute level of care that they do on a daily basis.
Our next question is from Susan in Havertown, This question is for Dr. Arkush.
Hello, thank you for taking my question. My husband is an employee of a school district in Montgomery County that has had several people affected by COVID-19, and he is support staff and operations. We are trying to get an answer on whether or not he is being paid by his contract or not for this time that the schools are closed. We can't seem to get a clear determinative answer from anyone in the district. We just keep getting answers that, well, we think you are, we assume the teachers are, we don't know if you are. I was just wondering if anyone at the state level or the county level would have an answer to that.
Well, I'm really sorry to hear that. That must be incredibly frustrating. So each of the 22 school districts in Montgomery County is governed by an independently elected school board, so they don't actually report to the county government or to me. But if you want to send me an email, I can see if I can get someone to get you an actual answer. And my email is V for Valerie, VARKOOSH at montcopa.org.
Thank you. The next question is from Rosemary from Ridley Park. She has a question about the impact this might have on summer pool openings.
Hi. Sorry to bother you. You were talking about children and stress, and the conversation I was having with the grandkids, they're worried about, oh my goodness, they won't be able to go swimming. And the coronavirus, let's say, if it was a private pool or in someone's yard, would that be still spreadable in chlorine, or is it too early now at this point? I mean, I don't know how to address that to the kids, That was my question.
Dr. Taylor, you want to take a swing?
I'll take a swing. I'm not an infectious disease doctor, a pediatrician, just following this closely like many of us are. We have no idea at this present time where we're going to be in the summertime with this pandemic. We don't know if it's spread in water. I would think it would be because it's spread by secretions, which can occur if you cough when you go underwater, depending on the proximity of other people. So for now, I would just unfortunately not be able to give your grandkids or kids any advice. I'm just saying that, we're all working very hard to try and make sure that there are safe, fun things to do in the summer. But we're going to be creative and to find things that are safe and to try and keep children's lives as normal as possible through this pandemic.
The next question is from Anthony, who wants to know if you're tested. What does it tell you if you recently had the virus?
Yes. You want me to ask the question?
Yes, if you wouldn't mind.
Yeah, I'm confused about the testing, whether if you've had the mild form of the virus and you're over it, does the test tell you that you've had it, and does it make a difference? And one quick thing is, how can South Korea be testing 20,000 people a day, and we are an anemic? Thank you.
Would someone from Half like to answer that question?
I do not have the clinical to be able to answer that question.
Dr. Arkush?
Well, I'll do my best. It's a very complicated situation. So in the early days of this epidemic, there were federal guidelines, not from Congress, but from the Centers for Disease Control, around which tests could be run and by whom. And the testing was largely confined to state health departments. So at least in Pennsylvania, our state health department has been doing a fantastic job, but the capacity of their labs with the testing technology that was available was fairly limited. Last Monday, a week ago Monday, the Pennsylvania Department of Health contracted with 2 commercial labs, both of whom are located in the state of California, and those are LabCorp and Quest, to go ahead and run these tests in Pennsylvania. And I know that in the case of LabCorp, they had capacity to do about 1,200 tests per day for the entire United States with the type of technology that they were using to run the tests. The good news is that in the last several days, there are 2 companies, Roche and Thermo Fisher, that have been approved using a different approach to running the tests, and they are going to be able to do thousands of tests a day once they're fully up and running. So you may have heard that there's going to be some somewhat greater availability of testing. There's going to be a site in South Philly and a site in Montco. There will still be need to have symptoms and some other things present to get those tests because it's still going to be relatively limited. But we should be able to get results back much more quickly, excuse me, and they should be able to, once they're fully up and running, run thousands of tests a day. So that should, within the next 2 weeks or so, greatly improve the access to testing for everybody in the country.
There's been several questions about whether or not flattening the curve is going to help. Dr. Arkush, would you mind speaking to why it's important for people to social distance?
Yes. So this idea of flattening the curve is about preventing a big spike in disease, a spike that is so big that it completely overwhelms the ability of our first responders and our hospitals to respond. So the example of that's happening in real time, it is what is going on in Italy, where the hospitals are completely over capacity and they are having to make some extremely difficult and painful decisions about who gets what kind of care. So flattening the curve means that we would still have disease in our community. We absolutely anticipate we're going to have disease in our community for a while. But the hope is that by taking all these social distancing measures, by staying at home, by not going out to restaurants, by not doing any unnecessary shopping, that the number of people who get the disease will not be as high, and the rate at which they get that disease will be much slower, with the hopes that we will be able to have sufficient capacity for our first responders and our hospitals to manage the individuals who do need to be hospitalized.
Thank you. The next question is from Donna regarding the CDC under the Trump administration. Congresswoman Shalala, if you could answer her question after she's done, that would be wonderful.
Congresswoman, thanks for taking my call. I just wanted to know what steps are being taken to reestablish the pandemic team under the CDC, which was reported to be eliminated by President Trump.
As far as I know, they have not reestablished that unit, but they certainly have put in place at the CDC a group of first-class scientists that are focused on the pandemic, headed by Ann Schulte, who is the deputy director of the CDC. But the Trump administration has cut the budgets of both the CDC, the National Security Council. There were 20 people there that worked on bioterrorism and pandemics, and those positions have not been reinstated. I think the CDC just doesn't have the strength that it had a few years ago, and one of the things we're going to need to do is to rebuild both those institutions, the FDA, the CDC, and the NIH, as well as state and local health departments, because we just do not have a readiness strategy. I don't know what what the virus is that's going to come 2 years from now. I don't know what its name is, but we better be ready.
The next question is from Jim from Wallingford. Jim from Wallingford would like to know more information about the benefits package. Jim, go ahead and ask your question.
Yeah, so it's a comment and a question. So the benefits package that was just passed is very confusing to read about in the newspaper, and it seems like it's a laundry list of incoherent policies. And there's another benefit package coming that people are talking about just throwing $1,000 at every individual, which also seems very incoherent and unfair. I'm not unemployed. I don't expect to be unemployed, and I don't need $1,000 in my pocket, but my next-door neighbor might need $2,000 in his. So who's influencing these policies, and how do we get our voice to put something more coherent and intelligent in place?
Sure. The package that was just passed, the House proposed a package and then negotiated it with the White House in order to see what could be passed. Basically, the Senate took a back seat and allowed the White House to negotiate with the House. And that just passed through the Senate today, and the White House is expected to sign off on it. That whole package was designed to build upon existing programs, so we didn't have to start new programs. So build upon existing unemployment programs and build upon existing emergency food, et cetera. The next package is just starting to be negotiated. You mentioned that there's some folks are talking about immediate cash payments of different amounts and who they go to, but a lot of it is under discussion. So if you have thoughts on that, please send an email to our office, because that's how it's going to happen. It's negotiation with all of the members of Congress.
The next question is from Donna from Philadelphia, who has a question about food shopping and being in the community. Donna, go ahead and ask your question.
Yes, I'm very apprehensive right now. I'm a young senior, as I spoke to you before about it. And I'm very concerned, and I'm adamant about all my questions about the going shopping, because I have no neighbor that'll help me. I have no one, and I'm very, very, like I said, extremely apprehensive, and I need to go shopping to get the rest of my food. Now, I'm trying to take precautionary measures, but, I mean, will I be okay to do this? Because if I don't have the food, I'm going to suffer, and if I do get the food, I might suffer. I don't know exactly what to do. And that $1,000 package, is that for everyone, as well as seniors that don't have much money, as well as everyone else?
Certainly. So we know that a number of our grocery stores, Giant, Acme, Target, Whole Foods, are doing special senior hours, usually first thing in the morning, so that only seniors are shopping then. It's not as crowded. You should call your local store to find out. We're also hearing about stores that are providing delivery service, coordinating with volunteers or otherwise so that people can deliver it to you. The bill has some special or some extra beefed up senior Meals on Wheels type programs as well. So I think the first thing I would do is call whatever grocery store you usually use and see if they have any special programs running for seniors.
The next question is from John from Ridley Park, who would like to know when to get tested for COVID. John, go ahead and ask your question.
Yes. Who should get tested and when?
If one of our doctors on the line would take the lead on this, Dr. Taylor.
I might defer to one of the other physicians for now. This is, something something that's being talked about all the time, and we don't want to have a mass rush for testing. So, today the guidelines are to call your healthcare professional. They'll have some screening questions like travel, like symptoms, like exposure to somebody who's positive for COVID, and then determine who should be tested. That's all I know right now.
Dr. Akush,
This is Dr. Arkush. I'm happy to answer that. So remember that we are in a situation of scarce resources, and we do not have widely available testing. So let me tell you how we're approaching this in Montgomery County. The most important thing to remember is that the vast majority of patients, about 80%, who become infected with the coronavirus are going to have very mild disease, and they will recover just fine. It's so mild that a lot of people don't even really know that they have it, or they don't connect it to this. So if you do have symptoms that you're clearly aware of, and that would be a dry cough, a fever greater than 100.4, or any difficulty breathing or shortness of breath, those are the three symptoms. If you have a runny nose, this is allergy season, so if you have a runny nose, that is not a primary symptom of COVID-19. So if you have those symptoms and you're fine at home and you think you can manage it and it doesn't feel too badly for you, having the test will have zero impact on what happens next, because you should be staying at home. You should, if you have those symptoms, you should be self-isolating at home. And there is no specific treatment for COVID-19. So although we would all want to know, it's human nature whether or not we had it, the advice right now is to just sit tight at home, let your doctor know what's going on, but there's no real need to get tested. And that makes more tests available for people who do need to be tested. So people that are immunocompromised, or individuals that have serious underlying medical conditions, or seniors who could be having something else like the flu or other infectious diseases. So it's, for certain people, it's very important that they get tested to make sure they don't have something else. So we're advising that if you're okay at home and you're basically healthy, you just sit tight for now until testing's more available, but you should call your doctor and let them know. If you have complicating or you're a higher risk patient, definitely call your doctor and discuss with your doctor, but please don't go there, because you can infect an entire doctor's office or a hospital emergency room if you show up and they don't know that you're coming. And then obviously if you're having symptoms that are life-threatening, go ahead and call 911. And all of our paramedics are fully prepared and trained and know how to respond to someone with COVID-19 and get you to the hospital safely.
Thank you. The next question is from Julia, who is concerned about resources, and she has a daughter who is a nurse. Julia, go ahead and ask your question.
My daughter is an ICU nurse at a local hospital, and they have concerns now about being able to get the masks that they need, because every time they go in a room, they need to re-gown and reuse mask, and they're feeling like they're not going to have enough.
Tim, would you mind taking the lead on that?
Sure, I can answer, and I'll defer to Mark in a second. But this is something that my wife is a nurse as well, so we're well aware of it. But the true unmet need is not there yet. We are managing the demand. This is part of the public's role of trying not to hoard supplies, but we have a management system, and I could speak for Delaware County. We have no unmet needs today, but we are well aware of the critical limiting value. So Mark, from a regional thing, and Mark coordinates for the hospital system.
Thank you, Tim, and your statement is absolutely correct. At the current time, we do have no unmet needs. We do planning for the scenarios. We are looking at that. We are coordinating with the local counties, the state, and the federal government in order to make sure that we have those resources available to protect our healthcare workers, protect the patients, and protect the public.
Thank you. The next question is from Claudia. She wants to know about medical and safety training. Claudia?
Hi. Yeah, hi. I'm sorry. My husband's kicking things around in the kitchen. I wanted to know, since Delaware County, unfortunately, has no health department, thank you, Republicans, we I'm not sure what kind of training is being given to cashiers at grocery stores, because the grocery stores are staying open, but I've been in a grocery store where they don't seem to be taking any precautions with the cashiers, and since we have no health department, I'm not sure if anybody is setting up training so that they understand they need to follow some kind of protocol. And also, I don't know really that Montgomery County should be seen as the hot spot, because we have no idea in Delaware County as to what our total count is. We could be as high as they are.
Tim, would you mind taking that question?
Sure. Again, public health is a matter that the state and the county has always taken sincerely. At the local level, food facilities are required by the Commonwealth to meet Department of Health standards. Obviously, there's a more localized control, like Monco has, an oversight over there. But I've been assured by our medical professionals that the public health that a restaurant or a store opens up, they need to meet those standards. And if people were concerned, there is a means to report that. Obviously, we all think that a public health department will be stronger, but there are municipal departments, media borough, have public health departments to ensure food safety. That is not something that would come under my department, but it should be there every day.
The next question is from Loretta, who just had her last day of work today. Loretta, go ahead and ask your question.
All right, I work for the regional rail. I've been there 20 years, never laid off. And we were told today, tomorrow's our very last day. We have to go in, do our paperwork, whatever, and close up. So they haven't told us if we're collecting unemployment or what that case may be. But I am a single parent. I have a disabled son that's in independent living. My daughter lives with me, and my son, he moved out, but he's 23, so he's just getting out of college. So I'd like to know what type of assistance is going to be out there for me. And I had a severe case of double pneumonia in 14, where I almost died. I had 66% of both of my lungs incapacitated. I had something called COP, cryptogenic organizational pneumonia, or it's called BOOP. Some doctors will know about it. Pulmonary doctor. I was the youngest person in the worst case in 20 years, so I almost died. So it's very critical that I get masks, first of all, and sanitizer for myself. I cannot get it anywhere. Secondly, where can I go to get help to have me pay my mortgage or help me pay my water bill or a PICO bill? Other places are willing to work with me, but I have to, of course, keep up with some things so that I'm not thrown an overload. And I do work a part-time job, but that's not going to pay much. So where can I go for help?
Thank you, Loretta. So we do have some links on our website, and any money that the federal government is providing is going to flow through these state services. So we would recommend that you get in an unemployment application as soon as possible. Keep abreast of what's happening with respect to what gets passed by the federal government, and we'll post updates on that in terms of what kind of benefits you might be eligible for, and those are going to be coming online, over the next couple of weeks. I think we've heard that the local utilities are offering a lot of forbearance, so you may be able to get agreements with those entities sooner rather than later. With respect to your prior medical history, you should probably check in with your doctor just to see if they want you to take any special precautions.
There have been a few questions, Dr. Akush, if you wouldn't mind taking these, on how you can stop passing the virus and whether or not it is safe to go out and play outside.
Well, in terms of trying not to pass the virus, there's some very simple steps that everyone should be taking. The most important one right now is stay home. That is the simplest way to stop passing the virus, and do your best. Obviously, people can go to the grocery store and do some limited things like that, but try not to go out unless you really need to. When you are out and even in your own home, make sure that you wash your hands with soap and water frequently, and you need to wash them for at least 20 seconds. I'm sure everyone's heard you can sing happy birthday twice. That takes about 20 seconds. And if you don't have soap and water available, you can use hand sanitizer if you have any. You definitely want to make sure that you cough into your elbow, not into your hands, or, cough into your elbow or your sleeve, so there's nothing on your hands. And you should stay away from people at least 6 feet. So no more shaking hands, no more hugs, particularly with people that aren't immediately in your household. And when you are out, try to stay about 6 feet away from people. It is primarily spread through respiratory droplets from coughing. At least that is what we know. And again, I have to remind everyone, this is a new virus. And so it first was known to the rest of the world in early January, and so a lot of work's been done very quickly, but these answers may be modified going forward as we learn more about the virus. But it's believed to mostly be spread through respiratory droplets. There is some evidence that the virus does persist on surfaces, particularly plastic and metal, for potentially hours. So that's why it's very important to keep your hands clean. And, for instance, if you go to the grocery store, try your best not to touch your face. It's very hard not to touch your face. We all do it unconsciously all the time. But do your best not to touch your face until you can wash your hands again or sanitize your hands. Play dates and other activities with kids has been really tough. You absolutely can go outside, and particularly with your family, the people in your family and your household, go outside and take walks and get on the trails and decompress a little bit outdoors. That is a wonderful way to release stress and anxiety from all of this very unsettled time. Play dates are tricky, and the simplest recommendation is not to have play dates among kids. Kids have a very hard time keeping distance and often put things in their mouth or share things, toys that are dirty. So if you can avoid having play dates, that's the safest thing. But if you have to, making sure that people's temperatures have been taken and that they've had several days where they haven't had any symptoms.
Dr. Akush, if you wouldn't mind also elaborating, a few questions came in regarding nursing homes of whether or not people can visit.
Right now, so the counties don't actually regulate the nursing homes. The Pennsylvania Department of Health does, but it is my understanding that no nursing homes are allowed to have visitors right now. So it's a great time to think about Skyping or talking on the phone. I do think some nursing homes are setting up video conferencing capabilities, that type of thing, so that people can at least see their loved ones, even though they can't go visit them in person.
And we do know that Fair Hills, the Delaware County home, has restricted all visitors.
Congresswoman Shalala, Michael from Springfield has a question for you regarding the Trump administration. Michael, go ahead and ask your question.
Thank you. And thank you, Congresswoman. I appreciate the forum here. It's great that you're all together. We're discussing the issues. Excuse me. My concern is not just the health issues, but the more political issues. I mean, obviously, we've had a really poor showing in addressing this issue at the administration level, and there's a lot of questionable things going on that I believe are going on, including some of the tie-ins the administration has in the development and distribution of the testing itself. And I'm wondering, what is Congress doing, or what do they intend to do to make sure that this gets investigated from the very beginning? I mean, it was incompetent, and we need to make sure that this doesn't happen again. And I wondering who's doing an investigation and who's keeping track of this.
Let me say this. We're in the middle of a pandemic, and there'll be plenty of time to launch a congressional investigation. But at this time, I think that we have to pull together. You'll notice that our first two bills were bipartisan, and I think it's very important for the country that we pull together to get this done and to give people the right kind of advice. We have world-class scientists in in the government, and I want to protect their integrity. But in terms of investigating why the Trump administration was slow and some of the criticism of the leadership, I think we'll have plenty of time for oversight on that. But right now, we need to pull together as a country, because this disease does not know what religion we are, what race we are, and certainly what our politics are.
Thank you, Congresswoman. The next question is from Christine, who lives in Chicane. Christine, go ahead and ask your question.
I wanted to know, if we go into a recession, how will that affect us?
Well, that's obviously top of mind for everyone right now with the slowdown in business that's required in order to get ahead of this virus. That is very much the subject of this third package that Congress is working on with the White House, to try to get in place some really quick relief so we can cushion the economic impact of basically needing to shut the country down for a few weeks in order to make sure that people are physically safe. So there's a lot of discussion about what's the best way to do that, whether it's quick infusions of cash to individuals. We know that has to be part of it, making sure that people have the means they need to take care of their families, and then what kind of things do we need to do to make sure that our businesses can get up and running and as quickly as possible. So that's going to be the subject of a lot of negotiation, and we really need the Senate to work on that before it adjourns again.
Excuse me.
Go ahead.
Me, Congresswoman. Dr. Monica Taylor from Delaware County Council has joined here. She's joined in.
Okay, Dr. Taylor, we've had a number of questions regarding progress on standing up an interim health department for Delaware County. Can you tell us what the status is on that?
Yes. So one of the things that we were working on, Chester County has offered to collaborate with us using their health department to help us combat the COVID-19. And so tonight, sorry for my lateness, I was at a council meeting, but tonight we approved the intergovernmental cooperation agreement relating to emergency public health matters between Delaware County and Chester County. And this is where Chester County Department of Health will provide Department of Health services to Delaware County related to the COVID-19 coronavirus pandemic. And so we passed that intergovernmental cooperation agreement today just right now in our council meeting, and we will be having a joint press conference to discuss it further tomorrow morning at 11 o'clock with Chester County.
And as I understand it, that gives us more tools to provide on-the-ground relief right here in the district.
Yes, it'll allow us to be much more aggressive in the way that we are contact tracing, and the more information and ability to give more information to Delaware County residents about where the patients are and what parts of the county, and even do some more mapping of where the virus is in the county. And so it'll be able to provide us with a lot more information, and therefore we can actually provide that to our residents, which we weren't able to do before, because under law we were underneath the state's Department of Health, which their laws are a little bit more strict, and they're only allowed to give us information by county, and that's all that they can give us. And so we were just going on the information we had from them. And so this will allow us to give our residents much more information.
Great. Thank you. The last question that we have is a combination of several that we've received on how long we believe schools will be closed. I'm not sure who wants to take the lead on that one, but I will defer to Tim or Dr. Arkush.
Well, I think that silence you hear indicates that we really don't know. And again, I just want to remind everyone that this is a brand new virus. It has been known to the majority of the world only since the middle of January. And we have all been learning, we're very grateful here in Montgomery County that we were not the first place in the world to get this virus, and we've been able to learn from the places that have gotten it before us. But there's just not enough experience or data to let me say with any degree of certainty when it will be safe to open the schools again.
Thank you.
Okay, that is all the time we have for the Tele-Town Hall. I want to thank everyone for participating. Congresswoman Shalala, Dr. Valar Kush from Montgomery County, Tim Boyce and Dr. Monica Taylor from Delaware County, Mark Ross from the Hospital and Health System of Pennsylvania, and Dr. Taylor from Drexel and St. Christopher's Hospital. If you want continuing information, you can check our website at scanlon.house.gov. You can also check, there's very good information on the CDC's website, the Pennsylvania Department of Health, our county websites, and the city is also providing updates. You can get text updates if you text COVIDPHL, COVID-PHIL, to 888-777. We had a lot of questions today. If we weren't able to get to your question, you can leave us a voicemail after the event, or you can call our district office at 610-626-2020, or you can go to scanlon.house.gov to submit a written question or comment. So in the meantime, please wash your hands, stay socially distant, and take care of yourself and your neighbors, and we will keep providing you accurate information as frequently as we can. Thank you very much.